Hello, everyone. Happy Women's Day, and it's a great pleasure to meet you all on this auspicious occasion of Women's Day. So, I hope you've had a great day until now, and you have a great evening from then on, because that women are always special, and I think we in this day their health is their priority. So all women out there, please remember that your health is your priority and it is your right. So taking care of your health is the utmost important. When it comes to diabetes and women, yeah, women can be affected with diabetes equally as men. There are few studies which say that women are a little more affected, but then there are discrepancies that vary from country to country. But women can also get all complications because of diabetes, just like men do. The uniqueness about women and diabetes is that the reproductive age group. So they are women are blessed with this reproductive. So they can get pregnant, they can deliver, they can manifest a child into the future. So thereby the uniqueness of the blessing of this can also lead on to some health hazard like diabetes during pregnancy. That's one thing. Definitely women have to take care about, thereby to handle diabetes during pregnancy or to avoid diabetes during pregnancy. Assessing the health during adolescence or in their teen is very important, like I said, young women, a young girl or a woman. And then when they move on to pregnancy, and then taking care of their health during pregnancy, from pregnancy, after delivery, if they had been a gestational diabetic, to take care of, to check their blood sugars to make sure they're not continuing with the diabetes, and the diabetes levels are well maintained because they are at a high risk. So taking care of that and assessing their blood sugar levels at a frequent interval as advised should be done for pregnant women who are diabetic, and after they deliver also. And if they are, after they've checked the sugars, if they're normal, again they have a very high risk during menopause. So postmenopausal women also have a very high risk of developing diabetes. So there again you have to pay attention and make sure you get your general checkup done and your diabetes workup done regularly, so that you can prevent a lot of complications, because women have a higher risk of developing heart disease and so on, especially postmenopausal women, of developing heart disease, cognitive decline. All this is much more common in the women. So the whole idea of today's live session is to get your clear your doubts on women and diabetes. So I'm open to discussion. So if you have your any queries or comments and about women and diabetes and how unique we are, please do post your comments and questions in the chat box. So I think we already have some queries there. Yeah, so we already have a question right now. It is, does diabetes increase the risk of polycystic ovary syndrome? Yeah, that's a very important question, I feel, because I did mention, women in their adolescence or in their teen itself should check their blood sugar levels, so that they are able to predict whether they can develop diabetes later and so on. So polycystic ovary syndrome, what do we mean by polycystic ovary syndrome is that most common signs of polycystic ovary syndrome is irregular menstrual cycles, the commonest symptoms of it is, or hirsutism, we call it, facial hair and the male kind of features in a female. These are the common, and when they do a scan, they can find small cystic, cyst means katti, we call it in Tamil. So small cyst can be there in the ovary. That is why it is called the polycystic ovary syndrome. And this is actually the root cause of polycystic ovary syndrome is what we call insulin resistance. So that is how polycystic ovarian syndrome happens. So insulin resistance, as some of you might have heard, is one of the reasons for developing diabetes. So a woman who has polycystic ovary syndrome has a very high risk of developing diabetes in the future. So how can she avoid this risk? is by keeping her body weight under control. Because if you see, polycystic ovarian syndrome is more common in the obese people, obese girls. So trying to keep their blood weight, their BMI normal, their weight under normal range according to their height and age would definitely help them in preventing developing diabetes at a later stage. There are sometimes polycystic ovarian syndrome can also have hormonal imbalances. So get your gynecologist or endocrinologist opinion if there is a hormonal imbalance to get it treated. So when there is a polycystic ovarian syndrome, one of the risk factors, but an additional obesity and also a very strong family history of diabetes. For example, both parent diabetic or a single parent diabetic, then again you will have to be very cautious and get a more regular screening. This is another common question they have is that can I have a healthy pregnancy with gestational diabetes? So, since the question is very clear as gestational diabetes, so gestational diabetes means the diabetes which we diagnose during pregnancy. So, the diabetes during pregnancy is usually of commonly we classify them into pre-existing diabetes or diabetes during pregnancy. So when I say pre-existing diabetes, like the name suggests, is that the woman was already either type 1 or type 2 diabetic, then she got pregnant. So that is pre-existing diabetes. So the treatment modality, everything will be a little different. Gestational diabetes means the woman developed diabetes after she became pregnant, and commonly it is somewhere around 24 to 28 weeks. GDM or gestational diabetes, we usually will be able to diagnose or will come only when they are 24 to 28 weeks, and if so, then you consult a doctor and get it. But most of the gestational diabetes, if diagnosed early, and if the blood sugars are well maintained with insulin and diet, they most of them will be an uneventful delivery. That is, they do not have complications in a well controlled gestational diabetes. So it is possible to have a normal delivery and a very healthy newborn in a gestational diabetes, provided the women gets her antenatal checkups done regularly, gets her diabetes blood sugar under control. And type 1 diabetic in young women, the diabetes will affect pregnancy, like if the baby also get diabetes or the baby is healthy. So that's exactly what we I did try to explain, because the pre-existing diabetes. So type 1 diabetes are women who develop diabetes at a very younger age. The commonest age is around somewhere around 12 to 14 years. Some children can develop diabetes, and most of the time it is a type 1 diabetes. These women, when they are at the reproductive age group, they can very all type 1 diabetes is can get pregnant. Type 1 diabetes is not a contraindication for pregnancy. However, if it's a type 1 diabetic women, the prenatal or before pregnancy workup, getting her blood sugars under control, keeping all her other parameters under control, keeping her weight under the normal range. So, preparing for her pregnancy and having a planned pregnancy will go a long way in preventing complications. So, as I did mention for GDM, type 1 also, if they do have a very good control of blood sugar, both prenatal, antenatal, and antenatal, usually there are no complications, or the baby the type 1 diabetic pregnant women can deliver very healthy babies. We have a lot of positive stories from our center. Personally, also I have many of my patients who have delivered healthy baby. But the commonest complication might be a macrosomia or a big baby, and the other one is a low for gestational weight baby. And of course, for the mother, she can develop preeclampsia and so on. But with a very good control of blood sugars and regular follow up, definitely a healthy baby and a healthy pregnancy is possible, even in type 1 diabetes. But plan the pregnancy, get her prenatal sugars under ideal control. Can diabetes cause hormonal imbalance? Okay, so this is a very broad question as such. So, in pertaining to women as such, in terms I did mention, and PCOS, again, some of them can develop hormonal imbalances. So, assessing the hormone levels and taking treatment for the hormonal imbalance is quite important in PCOS. Again, thyroid. Commonest hormonal imbalance in type 1 diabetes is hypothyroidism. So, thyroid levels should definitely be checked in all type 1 diabetes, and also in women, especially thyroid. Women have a higher risk of thyroid complications compared to the men. So, therefore, all women should at least once check their thyroid level during pregnancy. During when they attain menarche one time, then again during pregnancy, if already a thyroid, every trimester of their pregnancy, the thyroid level should be checked, and post delivery they have to check the thyroid levels. And then if there is an unusual weight gain and so on, again the symptomatically the symptoms are present, then again, or else during menopause, again the risk of developing thyroid imbalance is quite high. So definitely women should check their thyroid levels even at that stage. Why do diabetic women get frequent UTI and yeast infection? Yes, this is again a day-to-day question. I think we do face is that diabetes per se, is an how would I say it in the simple terms is that when there is sugar, all ants come in. All ants come towards the sugar. Just like that, when there is hyperglycemia, high sugar level, almost all infection risk is quite high. You take any infection. Why do diabetic women get more? Why do diabetic patients get more? Chest infection. COVID was even worse in diabetic patients. All kinds of infection, any sepsis or any infection is it's little immensely, it affects the patient much more when their blood sugar levels are not under control. And in women especially, because of the anatomy of their their talia, and because of how the anatomical nature of the women, their frequency of urinary tract infection is much higher, especially women who are sexually active and women who are dehydrated, so they do not drink enough water, and the genital hygiene is not good, then the risk of urinary tract infection is quite high. So, how do they avoid these urinary tract infection or the yeast infection? Actually, many of the women, diagnose diabetes per se because of this yeast infection, because of a fungal infection, itching in the vaginal region and so on. Only then they go to the doctor, and then the gynecologist advises them to do a urine examination, and also they pick up sugar in that, and then they also ask them to do a blood sugar level, and then they are diagnosed with diabetes, just like in men also. Genital infections, that's how they diagnose diabetes. Many women diagnose diabetes because of their urinary infection, because they can have increased frequency of urination, itching in the vaginal region. All these are signs of urinary infection, but all are also signs of diabetes. So that is why they can mix match. They can think it is a urinary infection, but it can be diabetes. And diabetes will worsen the urinary infection, and urinary infection will worsen the glycemic level. So vice versa, it will keep going on. So how do we prevent the urinary infection in diabetic women? Of course, the first point is definitely to maintain the blood sugars under control. So well controlled glycemic levels, the risk of urinary infection is very low. And next thing is to have drink plenty of water. When I mean plenty, in general, it's around 2 to 3 liters per day is the a healthy amount of water intake. Maintain a healthy genital hygiene. So wash every time you go to the toilet. So this it's not necessary to use Dettol or hot water and so on. Just washing regularly is more than with normal water is more than enough. No need to use hot water or so on. Just washing regularly every time using the restroom would be an ideal thing to prevent urinary infection. Okay, the next question is, how does diabetes affect hair loss or skin health in women? I think, yeah, it is a very important question, kind of neglected. can I lose hair because of diabetes? And the answer is a big yes. Diabetes can make women lose hair. One of the main reason again is because of the osmotic symptoms, that is losing out water from the body because of high sugar. The dryness can cause you to weakened cuticles and so on. Thereby, you can lose out a lot of hair. So, very high blood sugar is one of the signs is hair loss. The next thing in women you'll have to check is the thyroid level. Again, thyroid can also make you lose anemia. Anemia is very common in diabetes and in Indian women, so that can also make you lose hair. And the third, dehydration, as I said you, and dandruff, because of dehydration, dryness, and so on. Dandruff can be there, which is much more in uncontrolled diabetic again. So it can be hair loss, and many of them with a very high blood sugars, they the first thing they notice is the hair loss and hair fall, not hair loss, hair fall, and then they're worried, and then they come meet the dermatologist, and then they find out that the blood sugar levels are skyrocketing, and while with the control of blood sugar, most of the time the hair loss is arrested to a certain extent. But a healthy nutrition, healthy hair hygiene would definitely help the hair loss. The second part of the question about skin health, yes, diabetes and the skin is a huge topic on its own. But the commonest complication or manifestation of diabetes affecting the skin is dryness of the skin. So it feel dry and wrinkly skin with high blood sugars. Again, the same reason, losing out water from the body, the osmosis, we call it exchange for sugar. Water is lost, and thereby the skin can get very dry and wrinkly, and sometimes it can go up to the level of something called eczema, where extreme dryness, itchy skin, and so on. There are multiple things which can happen in the skin because of diabetes, but I want to definitely mention one thing which you all should look out for, is that darkening of your skin in the nape of the neck or underarm or under your legs, which can be a sign of insulin resistance, or what we call as acanthosis nigricans. And this is a sign that you might develop diabetes later. So if that is there, you have to try to reduce your weight and regularly exercise, and also get your blood sugars checked at least annually. Okay, so what is the link between diabetes and breast cancer? Yeah, a very serious question, and I think diabetes and cancer, as such, if you say, diabetes per se increases the risk of almost all cancers, and breast cancer being the number one cancer in women, it definitely does increase risk of breast cancer. So when you have a comparison of an non-diabetic women developing breast cancer, or a diabetic women developing breast cancer, the diabetic women developing breast cancer is much more than the non-diabetic women developing breast cancer. So definitely the link is more. That is why we advise a mammogram to be done for all women above 40 annually, and if the high risk, like above 20 itself, you have to get it done. But definitely annual mammogram, it's mandatory for all women. And if there are some signs of there's a lump, or you find discharge, or there is weight loss, and or you have a swelling in underarm and so on, definitely consult a doctor and do not ignore it, especially if you are a diabetic. What is the DK condition in diabetes? Um, that Ms. Anusha, do you mean DKA condition? Diabetic ketoacidosis, we call it. If it is DKA, if that is what you mentioned, uh, that is the acronym you use. Diabetic ketoacidosis, we call it DKA. It is an diabetic emergency, and it's more common in type 1 diabetic, where the blood sugar levels are very high, and it can cause toxicity to the body, and thereby the diabetic patient can go in for a diabetic coma also from DKA they can develop. So this is an emergency condition And when there is DKA, it is definitely you'll have to admit a patient or consult a doctor and get the hydration corrected, get insulin, the recommended dosage of insulin should be given to the patient so that the condition doesn't worsen to a coma or life threatening situation, because within a matter of minutes or so on, a DKA can worsen. Diabetic ketoacidosis is common in type 1 and not so common in type 2 diabetes. How does stress impact blood sugar levels and how to overcome? Since women are managing both home and work nowadays, yeah, just not home and work. I think there are many women who manage a lot more than that, and trying to strike the right balance, work-life balance. It's always a challenge for many of the women, and unfortunately, it's not as much as a challenge for the men here, for many of the men. But yes, stress, that burnt up feeling and you burnt out feeling when you like totally exhausted because of the too much demand at work and too much demand at home, also trying to balance it all. I think stress can definitely impact, and stress definitely impacts the blood sugar level. There is actually an entity called stress induced diabetes itself. So with extreme stress, a person can develop diabetes, and then but of course the person has to have a high risk, already a high risk patient only then. But still, because of this extreme stress, for example, a bereavement in the family and then so on, the blood sugars would have been completely normal, and then during the bereavement and during that phase, or during a divorce, going through a divorce or something like that, that phase the blood sugar levels can skyrocket. Only then the women or the person is diagnosed with diabetes and would need medication. Once the stress settles down, the need for medication will definitely come down, and many of the cases can even remit back to not needing medication and being only on diet and exercise. So definitely each of you superwomen out there should have your your day planned, and should have your plan to handling stress, so that you I definitely would have a strategy to handle your home and your workplace. So put effort so that you plan it in a way that it is not taxing you too much. Try to not necessary that all of us have to be superwomen and no do it all, know it all kind of thing. It is okay to let go certain things and try to prioritize your health also. So, what are the best foods for women with diabetes? So, there is no superfood as such for either women or men with diabetes. So, but the best food I would think of is that anything healthy, nutritious, and try to get as balanced as possible. Many of the women, what they do, they cook a healthy meal, serve everything to the family, and whatever is left over, they take it. So don't do that. You try to plan it in a way that each of all your family members, including you, get all the nutritive component of the meal, and try to get all the way. So when you have the plate system is the best way to know whether you're eating healthy. The simplest also to know whether you're healthy. So make sure there's enough fiber. So that comes from fruits and vegetables. Then there's little legumes, and then there is protein. So try to have a distribution of your protein, fat, and carb. Try to reduce your carbs as much as possible. Increase your protein and your fiber much as possible, and try to eat on your meal on time. That's very important. So I usually tell my patients, there are two group of people who never eat on time. One is businessmen, and two is are housewives. They are like, they don't have a time frame for their work. From morning till night they keep working. So try to get your meal on time, because the nutrition on time is also important, and try to include more fiber and fruits and vegetables. If your blood sugars are under control, then yes, of course, increase your fruit. If not, stick to just vegetables and very minimal fruits for your fiber content. Drink enough water, and include antioxidants in terms of seeds or nuts and so on. So, sunflower seeds, chia seeds, flax seeds, and so on, and also berries and so on, which are antioxidants. They're not necessarily love to buy all these expensive stuff all the time. You can, when you want to munch on something unhealthy, you can think of these even groundnuts and so on. Even otherwise, the free food such as cucumbers, buttermilks, and all that also should be an ideal thing for you women out there. Yeah, are women with diabetes more prone to heart disease? Up to a certain age, up to the menopausal age, we have a certain hormone called the estrogen. It's kind of an hormone try to protect it to a certain extent our heart. So until we lose out that hormone at around after menopause, until then we kind of have a protective effect on our heart. So women have a very strong heart until menopause, and post menopause, unfortunately, our heart is not as strong as it was earlier. So because of the hormonal changes, what happens? The risk of heart attacks is much more in women than men in the postmenopausal age group. So you have to be very cautious once you're crossing your 45 and so on, because that time there are a lot of hormonal changes, especially the perimenopausal women, a lot of hormonal changes which can impact your mood, impact your health, impact your skin, and also your heart. So you have to make sure you exercise regularly, make sure your diet is well balanced, and you're cautious about what you eat, and your cognition also. Even your cognitive decline can happen after menopause, so that also you pay attention to. Okay, what would you be your advice for women on maintaining their overall well-being and live a healthy life despite diabetes? Yes, this is definitely possible. Despite diabetes, all women can lead a healthy life, and we have success stories of women and men, often 90 plus, who are more than 90 years old, living healthily. I mean, healthy in the sense for their age, not having much complication. They're able to live through and do their day-to-day activities at variable levels. With some are even doctors and so on, with very good cognition and so on. Being a diabetic for more than 50 years, not 50, not age 50, 50 duration of diabetes being 50 years, yet they're able to lead a reasonably healthy life. So prioritize your health, know your priorities. So the work-life balance is very easily said over the online talk and so on. But each of us know how difficult it is, because somewhere you have to gain, you have to let go somewhere. So it's okay. It's okay. Don't compare yourself with anyone. Sometimes I do have patients who are sisters, or sister-in-laws living in the same family, both diabetic and both having different HbA1cs, and they tend to compare. So your comparison is only you. So look at your previous HbA1c. Have you improved from that? So don't compare with your colleague, or your relative and so on, to say that she's able to maintain, I'm not able to. You compare your your health level. How were you a year earlier? Have you improved from that? Have you taken any step for the betterment of your health? So every year you should take a step forward towards better health. So that is best done with a good sleep. Make sure you have a 6 to 8 hours of sleep. Sleep is very important for all, especially for women, to remain sane, to be able to handle the take the world on our shoulders. I think the first step is to get a good night's quality sleep. Make sure 6 to 7 hours, 6 to 8 hours of sleep. You do get a good quality sleep, and your hydration, your diet. Make sure you have a nutrition well balanced diet. Exercise. When it comes to exercise, I definitely want to tell a minute or so in about exercise for women. Women think it is exercise means it's just the cardio, that is walking is enough. I'm able, and many of the women think from morning till night I am working inside the house. I am running errands, and cooking, cleaning, washing, mopping, and so on. That would suffice. But definitely, yes, that is a very good physical activity compared to sitting in the couch and just watching TV. Definitely, you are working more, but many a time that's not enough. So because when we say exercise, there are three components we look into. One is the cardio component of it, or the cycling, treadmill, walking. These are the cardio component of the exercise, which is very important for women, for their heart health, for their general health, blood supply, and so on. The next component is the flexibility component. It's again very important. You don't want to have a catch and pull in your hip and so on when you get a grow older. Is that a flexibility? So make sure you do some exercises for your flexibility in terms of yoga or aerobics, or and so on, which will help your flexibility. And number three is resistance training, which is also very important. So that we call it the FAR principle. So flexibility, aerobics, and resistance training. So resistance training, it means that weight training. So many of the women feel, I'm not a bodybuilder, so I might become masculine if I do weights and so on. But muscle is a very important component for your health span. So the lifespan. So you have people living till 90s, 95s, and so on. But as in bedridden and in the bed, that's not what we want. Living till 95 or 98 or 105 in the bed is not what we want. Being active, that is the health span. So that's important. And muscle is one of the things closely related with health span. So if you have a good muscle, your health span will be better. So the resistance training, simple dumbbell, 2 kgs, or a 2 kg water bottle or a 2 kg dumbbell, regularly exercising your muscle, and so that you don't lose muscle. Sarcopenia, we call it. It's very common in women and men. Unless until you put some effort in terms of resistance training or protein intake, you are bound to keep losing your muscle gradually, and that can be very accelerated or fast forward when you are post menopause, and thereby suddenly you are unable to do any work, and you're tired even with a small thing, get irritable and so on. To avoid that, make sure you follow the FAR principle during your exercise, that is flexibility, aerobic, and resistance training. Need not necessarily you'll have to do all of these on a one day itself. You can distribute it as 2 days a week, or doing aerobic 2 days a week, during yoga 2 days a week, doing resistance training, and so on. That's another question. Does type 1 diabetes, oh, reversibility in future? Again, reversibility, no. If you're asking that in particular, it is not possible, especially in type 1 diabetes, because what happens in type 1 is that the body, the pancreas, the beta cell, pancreatic beta cell, we call it, that does not secrete insulin at all. So that is kind of a birth defect. That's a genetic defect. It's a birth defect. So there, unless until we do some gene therapy or something like that, there's no way that we'll be able to make the child's pancreas secrete insulin. So because from birth it is no. That's why logically, the only thing which can happen is an islet transplant or a pancreatic transplant, or something like the biogenic pancreas and something which are nothing to do with the kids, or the type 1 diabetics pancreas, but you're doing something externally. So there's no way that we can make the pancreas secrete insulin, because it's zero secretion. When there is a reduced secretion, we can enhance the secretion, but there is zero secretion in type 1. So very unlikely that complete reversibility. But there are the bionic pancreas and artificial pancreas and all that are coming. So for sure in near future, with so much of technological advancement, there is definitely looking forward to trying to prevent type 1 by some gene modulation and so on. Possible as per now, type 1 diabetes reversibility is not possible. Please do not go in and by someone advertising that type 1 can be reversed. Until today, across the globe, there is no reversibility for type 1 diabetes until today. Hopefully, there will be something in future, but the CSI pumps or the insulin pumps are the best things technologically available right now. The integrated pumps and so on, they are almost equal to the bionic pancreas, but not at there. But definitely, this is the best treatment available right now. But reversibility is not possible in type 1 right now. Is there any further questions, or can we conclude the Women's Day. Which that was a very interactive session, and many thank you, Ms. Anusha, for your content interaction and questions. Thank you, rest of you all, also for your questions and doubts. You can always type in our website your queries and doubts, and we're always there to help you out. So I think since there are no further questions and the time is also running out, and it was an immense pleasure to meet you all out there on this Women's Day. So prioritize your health and take in your health is in your hand, and make sure you protect your health. Thank you. Happy Women's Day to you all. Bye bye.